group on trigeminal neuralgia therapy. Okay, first comment is make sure you review anything you hear from me with your healthcare provider. And this is going to come from when I was in active practice, remembering I'm retired now. Trigeminal neuralgia, we reviewed it earlier. It's a disorder, that is an intense facial neuropathic pain. It's from a cranial nerve in the face. It's seen in multiple sclerosis, compression due to blood vessels compressing, microvascular disease, idiopathic, and certain neuropathies. I personally have neuropathy, and I can't stand headaches and migraine. I can't even begin to think about the neuropathic pain that I have in my feet being on my face. It seems unbearable. I've always taken this disorder very seriously when it's presented to me in practice, and when I've talked to people about it. You know, the electrical shocks, burning, shooting pains in your face. It's a very distressful disorder, very painful disorder. So in therapy, avoid triggers. The wind, skin can be very sensitive. High-pitched sounds and loud noise seem to bother it. Chewing, talking. Management overall, we've just reviewed the management of neuropathic pain, and I talked about using the anticonvulsants and antidepressants. The anticonvulsants that worked best when I was utilizing them, typically carbamazepine or Tegretol was probably the most effective. Trileptal was also very effective. Phentoin or Dilantin was often effective. Sometimes giving it to someone in the hospital with an IV load, really decreasing the excitability, helped a lot. Gabapentin and pregabalin, also known as Neurontin and Lyrica, were very helpful. Not as helpful as, though, I thought the carbamazepine and Trileptal. Another effective tool for some people is Baclofen, which is an antispasmodic. Things that reduce hyperexcitability are helpful. The low-dose antidepressants can, especially when it's associated with depression, which it usually is because it's such a severe disorder, they are helpful. They can also help us sleep. We review the tricyclic antidepressants and the NRIs like Cymbalta, and they're useful. Sometimes opiates are needed as rescue or as suppressing pain. But the question, from what I understand, is more on what do you do if that doesn't work? And I did medical therapy, and when it's not effective, I generally refer to neurosurgeons or interventional radiologists. When I was in Oklahoma, I used OU Health Science Center and Mercy Health Science Center, but when I was in Arizona, I started working with University of California, San Diego, and Barrow Neurosurgical Institute or Neurological Institute. I was very impressed with them, and they have a lot of data on their websites about these disorders and the therapeutic interventions. I had the best luck with my patient population in them getting gamma knife therapy, and after the gamma knife therapy, continuing medical therapy. Some people were candidates for microvascular decompression due to a vascular loop being around the nerve. Other people went for the balloon compression, which is very helpful for certain people. It's very popular with older patients or patients that have health concerns that they can't do certain processes on, and it's been really good outcomes. Again, I had better luck with the gamma knife therapy. There is also the percutaneous radiofrequency Thermo Rhizotomy, which basically means you heat up the nerve you use electricity to heat up the nerve through a radiofrequency technique. It's very, very good if the pain is in the ophthalmic division. And then there's the older therapy, the glycerol injections, which can work very well. Now remember, these are destructive processes that leave permanent changes. And a lot of times you'll have numbness or other sensory symptoms after these processes. So I would look at some of the great literature that's out there, especially on the web. The Trigeminal Neuralgia Associations, the University of California, San Diego, Barrel Neurological, Mayo Clinic, all have good literature on this. More recently, I am aware of stimulation procedures, particularly the trigeminal nerve stimulation, electrical stimulation, and the motor cortex stimulation. Both University of California, San Diego, Barrow Neurological Institute, and also Oregon Health Science Center, the Brain Institute, Mayo Clinic, and some of the hospitals in Houston were all doing this very effectively. When about the time I left practice, it was becoming a more popular means of controlling trigeminal neuralgia. And I've heard from the patient population that's out there that connects with me on mychronicpain.com and some of the other things I do, that motor cortex stimulation is working very well for them. So I think that's something also to be looked into. I've tweeted out some about that, and there's a lot of good information on that, so it's something else, another opportunity that should be looked at and discussed with your healthcare provider. Okay, well, that answered that question.